Hi, I'm Dr. Aamir Ahmed. I'm going to talk to you about bunions, what they are, why they develop, and the treatment options available, both non-surgical and surgical. Bunions are very common, and while they're often dismissed as a cosmetic issue, they can cause significant pain and functional problems if left untreated. A bunion is medically known as hallux valgus. It is a deformity that's caused between the first metatarsal long bone, which is towards the midfoot, and the big toe, and this leads to a deformity at the level of the big toe joint. This causes splaying of the first metatarsal towards the middle of the foot and the big toe to splay towards the outside part of the foot, leading to this bump that you can see when you look down into your foot. If left untreated, this can eventually lead to worsening pain, redness, swelling, as well as possible degenerative or arthritic conditions in the big toe joint. Bunions can develop due to footwear, abnormal mechanics, possibly inflammatory issues like rheumatoid, or even shoes that are too tight and causing significant pressure over time and repetitive pressure throughout the years on the big toe joint. Non-surgical management typically involves reducing the pain around the area of the bony prominence. This can include modified shoes like wider shoes, or possibly getting them custom made to become wider in the forefoot to involve the actual deformity or accommodate the deformity. This can also include paddings around the big toe joint, sometimes injections to the big toe joint to help decrease the overall pain, and possibly icing and over-the-counter medications. This can also include custom orthotics to help stabilize that first metatarsal, which may potentially help decrease the progression of the bunion from worsening over time. Surgical management can involve possibly surgery within the big toe joint or outside of the big toe joint. This depends on the severity of the bunion. If the bunion has no arthritis in the big toe joint that's involved with pain, you can potentially get a limb salvaging procedure that involves performing a osteotomy or a cut into the first metatarsal bone at this level if it's a mild to moderate case, and pushing the head over towards the inside of the foot and holding with screws to realign the big toe joint. If the more severe the deformity, the more likely you may have to get a procedure at the base of the first metatarsal that involves realigning the first metatarsal back into a straight position. And if this bunion involves arthritis at the big toe joint, this may lead to a fusion at the big toe joint between the big toe and the first metatarsal to help realign and hold the bunion in place and lead to hopefully reduced pain overall throughout time. If you have a bunion that's painful, worsening, or limiting your lifestyle, it's worth having it evaluated by a specialist. Early assessment allows for better treatment planning and in many cases helps avoid more advanced problems. We look forward to treating you and offering a good relationship between patient and doctor to get you pain-free and walking.